If you are anything like me, the thought of having to book a doctor's appointment can be really overwhelming. I mean, I have to call during the day, sometime between patients. I have to figure out either when I'm not working or take off work to go to the appointment. And then, of course, there's sitting in the waiting room waiting, all for a quick 5-10 minute visit. Yes, I get it. I'm a doctor, but I also see the other side. And I also can see how frustrating it can be. But here's the thing, there may be a better way, and that is the world of telemedicine, which really took off after COVID. If you are curious whether you can really get amazing skin sitting on your couch, this episode is for you. I'm Dr. Mary Mina. Welcome to my channel, The Skin Real, where I give real people real information about their skin so that they can make informed decisions about their skin health. Sound good? Let's get into it. This is my weekly recap episode where I break down my key takeaways this week from my most recent interview with Dr. Tara Acuna. She's a board certified dermatologist in Houston, Texas, and she practices virtual telemedicine or teledermatology in the state of Texas. If you want to hear the full episode, definitely recommend checking it out. I will link it at the end of this video. Okay, so let's just talk about something that might just change how you approach your skin health. And that is this concept of teledermatology. So, what is teledermatology? It's basically dermatology in the virtual age. It's you, a camera, and your dermatologist talking, whether it's a live video like you're in a Zoom call, or sometimes it's what we call store and forward or asynchronous, where you take a picture and you send it in, they evaluate it. And a lot of times it's a combination of both, but it's all done over a secured way, virtually and digitally, where you don't have to leave your home. You could get a dermatology doctor visit on the beach while you're on vacation. You could help your elderly parents get a visit without having to take the whole day off work. I have done it with my children where I don't need to bring my child actually in. They don't have to miss school. So I definitely see the perks of this form of evaluation. And COVID really, if there's one good thing that came out of COVID, it's that it really opened us up to doing things in a new way and doing things virtually and remote. And we realize, hey, maybe these office workers don't have to go into an office every single day to be productive at their job. Maybe we can evaluate people with skin conditions or medical conditions remotely without them having to come in. So I think it really helped this feel, which has been there. Telemedicine has been here long before COVID, but I think it really made it mainstream. And now that people know it's an option, a lot of people don't want to go back because they love it. They love the convenience of it. And as a dermatologist, while I do mostly procedural dermatology, so this is not something that is super great for my niche in dermatology, where I'm removing skin cancers or doing procedures, there are a lot of skin conditions that it works wonderfully for, including things like acne, maybe just discussing anti aging or hyperpigmentation, melasma, eczema, psoriasis. A lot of these conditions can be done remotely. Even skin checks, although I don't think this will totally replace an inpatient dermatology evaluation because so much of what we do requires touch, looking at it, evaluating it with our little lights that we use called our dermatoscopes. So while we can look at certain things and say whether it looks concerning or non-concerning, really an in-person evaluation for a skin check is probably still going to be your gold standard, just in case something has to be biopsied. But as dermatologists, I mean, so much of what we do is visual and we look at pictures all the time. Even when a patient comes in, have an evaluation, one of the first things I want to do while they're telling me their story is I want to lay eyes on it too and see it because that gives me so many clues just looking at it. And so as dermatologists, telemedicine really fits in nicely to our field of practice. And like I mentioned, not everything is going to be perfect for a virtual visit, but there are many chronic conditions that can be really well managed and treated remotely. So, what skin conditions can be treated virtually? Well, let's break it down. Teledermatology is not about doing cosmetic procedures. through a webcam. Okay. You cannot get Botox virtually, at least at this time. But it is great for things like acne, where you need those monthly follow ups, eczema, psoriasis, hyperpigmentation, or melasma, things like rosacea, or just a routine medication refill. Maybe you've been on your spironolactone and it's been a year and your doctor wants to check in and see how you're doing. This way, it can be a quick check in, make sure you're not having any problems with the medication, and it can be refilled. And you can be on your way in about 15 minutes versus hours if you had to actually go in for an appointment. Now, here are some of the downsides of virtual exams. Again, it's not, I wouldn't say it's the greatest for routine skin checks. Sometimes a photo of an image or a lesion that you're concerned about can be a little bit easier to evaluate that way than over a video call. But if something does look concerning, we can't do biopsies virtually at this point, unfortunately. So, your practitioner, your dermatologist will likely recommend that you go see someone in person to actually get a biopsy of that lesion, and a good teledermatology provider will be more than happy to help you find someone relatively close in your area. So there are some limitations, but certainly it's a great way to triage. And I know that at the VA in here in Atlanta, the dermatology residents do this virtually all the time with the vets because they are coming from hours away. And they will have a photo of the lesion that they're concerned about. And then the dermatology residents can help triage. Okay, this looks concerning. We need to get him or her in sooner. This is benign. It looks scary, but it's totally harmless. And we can give them some reassurance while they wait the 3 months or whatever it is for their inpatient appointment. So I think of dermatology perfect for this kind of bread and butter dermatology, the everyday stuff, the routine check ins, the medication management and refills. And really, it's so crazy that sometimes there's 3 to 6 to even 9 months to see a dermatologist. So this really helps cut down on that. So you might be wondering, how does this work if you've never actually done this? Well, usually your dermatologist will send you a link. You will join on your computer or mobile phone, whatever you prefer. It will be through a secure platform, and so it's HIPAA compliant, just like when you were seeing a doctor in person. And all you need, I would say, is good internet connection, and really decent lighting is really helpful so that your dermatologist can carefully evaluate you. And if there's something specifically you're concerned about, go ahead and take some pictures on your phone. And a lot of these teledermatology practices will allow you to upload that along with your any medical information so that your dermatologist can evaluate that as well. That can be super helpful. We can zoom in and really look at the details that are harder to pick up on a video where people are moving and the lighting may not just be right. So I know during COVID, these visits were covered, but a lot of these platforms don't even take insurance. They just do a direct pay or cash based model. And you might be wondering, well, does that get expensive? Here's the thing, because virtual medicine has a very low overhead, we don't have to pay a ton of staff. We don't have people having to verify insurance and things like that. The actual visit may be more affordable and lower than you think. And certainly if you have a high deductible and all your premiums, when you look at it, it may be significantly less expensive than going through your insurance. But what this is really ideal for is someone who doesn't want to wait months and months to be seen, lives far away from a board certified dermatologist, and really needs care, and perhaps lives in an area where there are not a lot of medical providers, or they would have to take time off work that they can't afford to do, and they want just transparent pricing and more time with their doctor. That's the thing with the insurance based model. Very, very rushed appointments. You wait a long time for about 5 to 10, maybe 15-minute visits that are frustrating to us as physicians as well as our patients. So a direct pay allows for actually a more in-depth and longer visit with your doctor. So I would just say, if something isn't covered by insurance, don't automatically think it's going to be exorbitantly expensive and out of your price range. Definitely delve in a little bit further. You may be surprised how actually affordable it really is. And a lot of times your dermatologist can give you what's called a super bill, and you can then submit it to your insurance. so that you get credit for it on your deductible. But really, I think all in all, these virtual visits are a cost saver. You don't have to take time off work. You are not having to pay for childcare or parking. There's no gas, there's no commute. The time savings is humongous. And I think that this is really a game changer in really forcing people to think about how they want to receive their medical care, that not every visit has to be in person and that they can actually get longer visits and more personalized care with better compliance because the barriers to following up are so much lower. Because when it's easier to see your doctor, it's easier to follow up. You're most likely going to do the treatments and get the results you need. And of course, you know that consistency is so key in skincare. Now, you might be thinking, I'm older, I'm not tech savvy. Can I still do this? And the answer is yes. Even my 102-year-old grandmother emails. So if you have a computer and internet connection, and you can click and you have an email, you can click a link or go to a URL, you can do this. You don't need fancy equipment. You don't need a webcam. You don't need a ring light. You can sit by a window. You can maybe get a friend, a neighbor, or some adult children to help you if you aren't as tech savvy, or your younger children. My kids help me with some of my tech stuff. And they can help you. You sit in front of the screen and you can have that direct access with your doctor, which is just so cool without spending half a day doing that. But in these visits, they really can do just about everything except for a procedure that you would have in your regular dermatology visit. They can prescribe medications, they can evaluate how you're doing, discuss risk and benefits, all that stuff that can be done just in the comfort of your own home. So, no matter your age, don't be scared just because you're older. Just because you're not a technology native doesn't mean you can't do this. And if anything, I think it could be extra helpful for older patients who maybe have mobility issues. They have transportation issues. They require a neighbor or a child to take off work to take them to the visits. I know that that takes a lot of time for many of my patients and their family members. So this a virtual care option really is just such a cool out of the box way to think about things. And I really see it becoming really mainstream in the future. Not everything, though, is rosy about telemedicine. And of course, there are some companies that really aren't providing medicine and medical care. They're really just prescribing things. And so you do want to be a little cautious, a little wary of these platforms where they are just churning out the pharmaceuticals, the prescriptions, because there have been some reports of people having side effects they didn't know about or medication adverse reactions. And I really think this is because there was that lack of a patient physician connection and communication that the person didn't know necessarily who they were seeing. They didn't have a thorough history taken. They were really just prescribing medications to anyone who came on the platform. So you do want to be careful about these. This is not a typical telemedicine practice. This is really a practice that's just trying to get you to buy their prescription medication. So there are a lot of great companies out there doing great work making telemedicine more accessible, but you just want to be cautious that you are actually establishing a physician patient relationship with your provider and that they're taking a good history and making sure that medication is the right way for you to go. Unfortunately, there's not a universal website I can tell you to go to if you are interested in seeing someone who does virtual dermatology visits. Hopefully, that's something that will be coming this way, but certainly you can search with hashtags on Instagram, TikTok, social media. You can Google and call around in your area or ask some of the doctors you know or dermatologists you might know or friends and family. Hopefully, I do foresee in the future there will be these directories where you can go and find someone who does virtual visits. But at this point, we don't have that. And because doctors are licensed in specific states, a doctor would have to be licensed in all states, including DC, to be able to see all patients. And while there are some people doing that, it's not necessarily the norm at this time. So if you live in Georgia like I do, you would have to see a dermatologist who is licensed in Georgia who can take care of you. This is such a cool field. I really see this changing medicine and changing healthcare, the delivery of healthcare, and also how we think about receiving medical care. Super cool. I definitely recommend checking out the full episode. You can check it out here, and I will see you next week.